Hey, what's going on, guys? Dr. John here.
Hey guys, it's Travis.
And I'm the Chief Medical Officer of the Garden Medical Spa.
And I'm Travis Laverne. I'm the medical director at the Garden Medical Spa and have been for the past couple of years.
It's been a wonderful journey together, hasn't it?
Yeah, it's been
Yeah,
cool. And I'm excited for tonight because we're doing something a little bit different,
this
right?
is much different.
Yeah.
We've had things like this, but never at this level. And I think it's quite cool.
Yeah, it's cool. So today we are, day one of what we're considering to probably be one of the most truth telling podcast, informational, educational, you call it what you want type sessions where we're going to bring everything aesthetics to you guys as consumers. This is another jumping point, another leverage point for us to be able to bring you the latest trends, debunk the stuff that's out there. And,
There's a lot of interesting things out there as this industry has grown, and we've seen it growing over the past 10 years. There's a lot of good stuff, and there's a lot of not so good stuff. And I think the consumer, the clientele, have a hard time kind of weaving their way through this web
yeah.
of aesthetic medicine.
I was thinking about this morning because I mean, obviously, we knew we had this podcast this evening, and full day of patients today. So, as I was trying to think about how to launch this thing, aesthetic medicine is interesting, Dr. John, because aesthetic medicine it's art,
Mm-hmm.
right? It's medicine.
Mm-hmm.
It's fueled by a lot of money,
Yeah, yeah.
So you've got money, medicine, art, that creates this like very dynamic environment where there's just so many options and so many different things that likely don't work. And, the industry tugs and pulls on providers, right? And
Yeah,
tries to manipulate what we do and what's
yeah.
effective,
That's
right?
right.
And
That's
it's
right.
often driven by very little science,
Yeah.
which is one of the things that I'm so proud to be part of at the Garden Medical Spa since day one. My time here at the Garden, one of the things that drew me in was that everything we do at the Garden is backed by
That's
science.
right. That's right. No fluff, just results.
That's it,
That's right.
And as cliche as that might sound to the consumer, I quite dig it. But with that
Yeah.
being said, it's true, right? I mean, we
Mhm.
do not adopt technology, we do not adopt treatments. We don't speak about those types of things unless it's been one proven, right?
That's right.
Proven are and has a high level of patient satisfaction
That's right.
and safety,
Hmm.
right?
And we've been blessed to have influence and develop protocols that are used across the nation at our starting at our place in New
Yeah.
Jersey, and it's kind of been adopted all throughout. So it's
Yeah, it's
cool.
been, I mean, yeah, your point exactly. Aesthetic innovation, like Guard Med Spa has been a springboard for that, whether it's
Right.
energy based technology, different injection protocols. Dr. Michael Mirmanish down in Florida doing plastic surgery things at the tip of the spear. We've always done things safely, but we've always done things effective. And I would consider us, definitely industry leaders when
Hmm.
it comes to these types of services.
Yeah.
One thing that I'm also proud of, I know you are as well, is that, we do our best to not get tugged and pulled in these weird directions,
Yeah.
right? I mean, it may not feel like we're offering you the latest and the greatest, and I promise you we are, but we know what works
That's right.
and we know what's safe.
Yeah, I want to give a special hat tip off to my brother and down in Florida. He runs the Garden Med Spa down there, and he's been instrumental in the development of this wonderful thing that we call the Garden Medical Spa.
Yeah.
We have a lot of locations now, and it's been really cool to see the growth of it.
Yeah, it's crazy. I mean, when we talk about it, we'll jump into some cool topics in a second, but if you look at our footprint in South Jersey, I don't think a lot of patients realize how big of an organization the Garden Medical Spa is.
Yeah.
I mean, we've got 5 locations now in South Jersey:
Hmm.
Voorhees, Collingswood, Mullica Hill, Sewell, Northfield.
Yeah.
But that's not even talking about what Michael's doing down in Florida, right?
Yeah.
You've got Tampa Bay, you've got North Palm Beach, we've got a couple in Clearwater.
Yeah. It's been cool.
So having that southern arm extends our reach, and I think we're all 100% motivated in this like growth mindset, right?
Yeah.
I use this like weird analogy with clients sometimes, and I'm like, you can plant a garden anywhere.
Yeah, that's right.
So,
Well,
yeah,
and we haven't been touched by that private equity thing, right? We're run solely by our team.
mhm,
We're not tugged and pulled as just taking that from you from that. I don't know, this I guess you would say, lack of better terminology, greediness of the private equity groups,
Yeah.
where they're pushing, people to do things that maybe don't work, or they're forcing those providers to do things that maybe are more fluffy
Yeah.
than more result that last rather than result driven.
Right. And, and everything has its, there's good ones out there, there's bad ones out there, just like anything. But what I think also allows us to execute our treatment delivery so well, and not even from a provider perspective, from our RN team, from our esthetician staff, is people seek us for as an employer
Mm,
because we are not owned by these large private equity firms.
that's right.
Because, at the end of the day, I always, coming from a military background, I always say people first, mission second.
Yeah,
So
that's right.
I know you believe that. I know your father believes that. I know
Hmm.
Michael believes that.
Hmm.
But it's our management team incorporates that. But it's important because we built something here. You've built something here since what 2014.
Yeah.
That you can sense the pride behind it, right?
Hmm.
And
It's like a child.
it's right, exactly. So you know keeping good people is vital to success. Anybody who's listening that owns a business can sympathize with that. I mean,
Yeah,
finding good quality people is the hardest thing
it
in
is.
operations.
I'll tell you, man, that the team right now is awesome. Man. I'm like super excited for their growth, and
Yeah.
it's been wonderful to see them develop, and so
Yeah.
it's been really cool.
Yeah, it's true professionals. And
Yeah.
with this podcast, you're going to have an opportunity, everybody, to meet. We're going to bring them on here. We want you to
Yeah.
hear their perspective as well. It's going to be cool to take this podcast to
Yeah,
like whole
I'm
new heights,
excited.
and we'll see what grows from it. But without further ado, we want to jump into to one topic today that I
Yeah.
think will serve you all well as aesthetic consumers.
Yes.
We've got a big Tox event coming up June 9th, Monday, in our
right.
Voorhees location.
Yep.
I'm super excited about it.
Yeah,
It's
it's
going to be
with-
pretty unique, right?
It's going to be very unique. So we teamed up with Evolus, and Evolus has a really wonderful botulinum toxin product called Jeuveau.
Mhm.
I think it's the one that we use the most of.
Yeah.
And we've used pretty much everything at this point, whether it be the Botox brand or what is it, Zoomin,
Yeah.
Jeuveau. So Jeuveau, we have this really cool event. They're bringing a huge bus on June 9th to our Voorhees location. And the bus is like this gigantic Greyhound that has 2 treatment rooms in it. It's going to have like a tent associated. There's a DJ.
Mhm.
It's going to be a big party, and it starts at around 9:30 and it goes till about 5 p.m.
Yeah.
And we thought, because we're having this wonderful, awesome party, that we might as well talk about botulinum toxin and debunk some
Yeah.
stuff, and just talk about like how we like to do it. And it's such an interesting
It
topic.
is.
It's so
Well, and it's evolving. And to
It
be
is.
honest with you, I mean, recently there's been a lot of evolution in regards to neurotoxin and where we're injecting and how we're injecting, the results we're seeing. And I'm glad that we're talking about this Tox event.
yes,
Because I talked to a lot of people, and there's a lot of this like almost uneasy feeling about doing these type of Tox parties or these
Sure.
Tox events, because a lot of people almost get this sensation that it's not taken seriously, or maybe it's unsafe, or it's unsanitary, or we're not taking the proper attention for each patient. And that is something I want to debunk right out of the gate, right?
Yeah,
And I
of
think
course.
that's something that when people hear Tox parties or mobile med spas, they associate this lack of quality in a sense, I feel like,
Interesting. Yeah, that's interesting.
and I wanted
you
to
say
make sure that we kind of nip that right
Yeah.
now,
Oh my
right?
gosh,
And I
yeah.
think something that we do when we have these, mass Tox events
Yeah.
that feel like they're at a discounted price, it's no more than to just drive hype and business and opportunity for
Yeah.
everyone. But I can promise you and assure you that safety, quality control, our staff is highly qualified and trained. I mean, this
Well,
is an execution that has many months of planning.
Oh my God, yeah. And our egos are too big to
Yeah.
not give like 10 out of 10 results. I'm way too. I think way too much of myself.
Well, no doubt, right? But I also think it's beautiful to talk about, like, this is a good segue. Like, neurotoxin is not a cookie cutter style
Mm-mm.
of a treatment.
Mm-mm.
There's a lot of treatments out there that I can often replicate and over and over and over again with really similar settings
Yeah.
and procedure. But neurotoxin is one that really requires effective evaluation of facial anatomy. I mean, just anatomy in general, right? Because
So
we're now
true.
doing things off the face.
Mhm.
Understanding the anatomy, understanding the age of the patient, understanding the needs of the patient, understanding your skill
Dose,
set,
the dose,
the
that
dose,
you would
their
use,
reconstitution.
the
I
reconstitution.
mean, there's so
yeah.
much that goes into these individualized, customized treatments. And I
Yeah.
can promise you that every toxic patient we see, whether it's at a big party or it's a single appointment for the day, is getting the same level of attention and
Oh my
care.
gosh, yeah.
But
So
let's talk about that for a second,
yeah,
Dr.
when you
John. Let's
go
talk about the
into
complexity.
so when you go into so I always think about it like this: like, what are the goals? What are the ultimate goals when we treat the most common area? And the most common area for that I treat, and I'm sure you do too, is that we call the upper one third, right? That consists of the 11s, the crow's feet, and this part here, the frontalis, kind of makes those horizontal lines in your face.
Yeah.
And I always tell clients, I say, the goal here is for lifting, and you have to approach it so that in every way that you inject, you're thinking about how this muscle is going to react to lift those eyebrows, to open up the eye, to lift the mid part of the forehead. And if you have that goal in mind, then you're going to place where hopefully if you have that skill level, you're going to put the right amount in the right place so you achieve that lift. And I think for us, we've distilled the injection points to a very particular type of injections that always lead to this wonderful lift.
Hmm.
Not too much. Now you might say, oh wow, well other people have tried to lift me, but they've made me maybe too heavy here, or they've made it too spocky here. That was actually not because of you. That was mostly because of the way their injection points were, and maybe they just didn't have the experience or the know-how of how much to put, where they weren't paying attention the right way. Who knows? But overall, if you go to some place like us, you're going to get this overall beautiful lift to your upper one third.
Yeah, I mean, once again, knowing your anatomy, knowing your patient,
Right.
doing the evaluation beforehand. I've had clients come in as I'm discussing, the procedure, and I ask them to, make those dynamic facial expressions so I can evaluate the way their muscles are contracting. And newer clients will sometimes look at me like, "Well, why are you asking me to do that? Why am I raising my eyebrow? Why am I
Yeah.
furrowing like I'm looking at the
Yeah.
sun?" And I say, "Well, that's because I'm seeing how your muscles are engaging, right? I've never had to
Right.
do this before,
Yeah. Yeah. Yeah.
right? There's no other way to know how to inject the muscle patterns, and having the opportunity and the privilege truly to operate with your brother on the
Mm-hmm.
face
Mm-hmm.
and being beneath the skin.
Mm-hmm.
These everyone's anatomy is very different, but the muscles are just so unique on every individual.
Yeah.
Um, you know,
You can
there's
see it.
always a counteraction to what your action is, and you
Mhm.
have to understand that, right?
That's
All
right.
these muscles being interdigitated the way they are in the face,
Mhm.
injecting one area of the face is going to have a impact on a different region of the face. So
Well,
understand that's important.
that's so important. You're so correct on that. You're touching on the point of like why we have to do this whole group together. A lot of people are like, "Oh, just do my 11s." Well, this whole area, it interacts with each other. This upper one third is so dynamic. It interacts with each other. And if you just do one space, it oftentimes more than not, it's going to look a little funny.
Yeah.
So you really want to take care of the entire thing. Let's jump to something. Let's jump to these different things. Like when we talk about the princess eye.
Yeah.
We do these like particular things that people love, right? And we've coined that. And I think that because we know the anatomy, because we've studied in depth below the skin, and above, we know where that orbicularis oculi muscle interacts and attaches to. And I think by knowing these things, maybe more than the average person, the average injector, average provider, we're able to place this botulinum toxin, Jeuveau, as we love it, Jeuveau, in places where it's going to upturn the eye like a Disney princess. And a lot of people ignore that area. It's such an important area.
Yeah, it's great. And once again, I mean, you're utilizing muscles in ways that, people weren't really considering when the standard upper one third treatment was being executed.
Right.
And this goes back to that customized tailor approach. And, truly, anyone over the age of 40 is probably a good candidate for a blepharoplasty. And that's
Sure.
really just excess skin on that above eyelid that's
Mhm.
becoming a little loose and starting to sag
Sure.
due to a variety of aging processes, right? But neurotoxin is probably one of the more effective treatments in reducing some of that hooded eyelid by using the muscles
That's
to
right.
counter pull on that tension, right? And
right.
that skin laxity. So
I
it's a
always
good one.
tell people, I say, listen, I'm going to get you to the maximum a needle can get you to. And if you're still unhappy with it, it's time to see your plastic surgeon, hopefully my brother, to fix, get the blepharoplasty,
Yeah.
and I think people enjoy that.
It's good. It's a nice option.
Yeah.
It's a temporary option, right?
Mhm.
So that's the one thing I also love about neurotoxin, right? Less is always more. That seems to be our approach
Yeah,
for the most part. We can
I think
always
so.
add to it. We try not to overdo it. One of the things that I know we do well and probably not done well other locations is it's not just about that treatment. When I inject a client with neurotoxin, I'm thinking about the next 4 to 5 to 6 to 12 visits down the road and how they're going to age through these 12 visits and what areas I should be injecting now and not injecting, right? Based on that thought process in my mind, right?
That's right.
You know, the eye area, once again, a very important muscle that surrounds the eye. You know, so the more we weaken that muscle, you know, muscle essentially atrophies through disuse. And the more we go medial with that neurotoxin and create further disuse, then, you know, we don't get that squeeze effect around the eye that we often hope for, right? We're thinking about these things at the Garden Medical Spa that I don't think majority of practices are considering, right?
I'm
Your
hearing
health, the future injections, and
Right.
what we look like in a decade from now if we continue down this pathway, or better yet, we don't start incorporating other areas of the face. And that's something I wanted to jump into
That's
now,
such a good point you make. Yeah,
you know,
that's such a
because
good
the
point. I
upper
like
one
that.
third,
Yes.
although very standard for most medical spas,
Yeah.
we're seeing, and I know I'm seeing a lot more clients doing more of this facial balancing with neurotoxin where we're going outside of this upper one third
Absolutely.
junction, mid one third, lower one third of the
Yeah.
face specifically,
Yes.
and seeing some really beautiful results.
You know, it's so cool. I love that you brought that up. So, let's talk about, you know, this thing where a lot of people, they will, not take in consideration other areas, and they'll kind of ignore this big old muscle here called the masseter muscle, right? And this masseter muscle, you know, is a thick one, man. It's a really strong one. It's used for chewing and all this other stuff, and you grind your teeth. Sometimes people clench, and I'll tell you what it really does to your face is it squares you out. Now it's not a bad deal for a guy, right? Because it's nice to have a square face. It kind of indicates we have testosterone. But for a woman, it's not the best thing, and it's hard because as you get older, this is you know, this fat pad here is kind of dropping off, and you're getting more square anyway. And I've seen other places where they'll put filler here without consideration for the masseter muscle. They'll keep that really thick. The masseter will stay thick. They won't put any thought into that. And then they have to overfill this cheek, and the people look funny. They look like cats. And if they just did what I call cheap cheeks, what we call cheap cheeks, and you put a bunch of tox just right here in this masseter, you cause a little bit of a nice, you know, slimming effect to it, right? Then all of a sudden now you can use less filler here. You have to use less, you know, energy type treatments there for a wonderful look, a wonderful feminine face.
Yeah, it's nice. I mean, that's one of the very effective areas in that lower one third that contributes to a beautiful aesthetic effect and physical benefit. You know, those clients that clench and discomfort, jaw pain,
gosh, yeah.
TMJ. I mean, neurotoxin, the masseter muscle, migraine headaches. I mean, it's a great area to inject for the physical benefit, but the cosmetic benefit that you just highlighted, absolutely.
It's unbelievable. I mean, I know, and I know you have too, is I've cured headaches, like these tension headaches that people get because it's all stemming from this masseter insertion site into the temporalis, and then that leading to this hypertrophy or like thickening of the muscle here.
The radiation of tension, you know, and as you know, I have a lot of clients who've been seeing neurology for migraine headaches, you know, and they're getting the neurotoxin injected in the occiput and the rest of the, you know, the head and the neck and the shoulders.
They're ignoring
they're ignoring the face, which, I mean, tension headache. I mean, there's so many dynamic muscle components in our face, and just by relaxing that muscle mastication, which per square inch, strongest in the body, no doubt, has huge benefits.
That's right.
You know, and what's cool is pretty recently, probably about maybe a year ago now, a study had been, you know, published, and it's gaining some traction for the upper one third in regards to revolumizing the mid face, the under eye, and the temple without having to use dermal filler or energy based technology. And what's really cool about this is, to your point, how we talked about these muscles interacting is, you know, there's certain muscle junctions in the lower portion of the face that are causing a depressor effect, and they're pulling all of your tissues down.
That's right.
And as you get older, that bone support is no longer holding things and suspending things like it should. So as this depression activity is getting stronger and stronger, everything is descending. So by doing these strategic injections along your jawline, your muscle that we call the DAO, which kind of spans from the lateral portion of the oral commissure and down the platysma band of your neck, you release that tension, and MRI studies have shown revolumization of the midface, the under eye, and even the temple due to that interdigitation of all those muscles.
It's kind of amazing.
It's a
Yeah,
it's unbelievable.
it blows me away. When I get a really great result with that, I'm like, oh my god, it looks like I actually did volume enhancement with this person. But in reality, it was just.
I mean, this may be a bold statement, but my prediction in the next decade, I think lower 1/3 neurotoxin becomes almost as popular, if not more popular, than upper 1/3.
Oh man, that's such a good point. So there's another one that you're gonna love. So a lot of ladies and even guys will try and get filler in this area here, this mandibular, and your jawline, in order to get like a sharper jawline, right? That's all the rage. And in reality, if they just put some tox there, just put a little bit of Jeuveau there, you're gonna get that release of this muscle, right? And you're gonna get that tightening of your jawline, that Nefertiti lift. We call it Nefertiti lift.
Yeah.
And you get such a beautiful look, and you don't have this over volumization of your lower face. Whereas in a woman would be really bad because then you square out, right?
Yeah.
So we always do the tox through the jawline here, and that really snatches you up, as everybody likes to say.
Yeah, no, it's great. That marionette line, that redundancy of the pre-gel sulcus. I mean, the fix. I mean, still, what a lot of people will do is add volume, right? And now you've just created more volume in an area that's already redundant in tissue.
Yeah.
So that's why I'm a huge advocate for energy-based technology in regards to that. IPLR, microneedling resurfax laser, CO2. I mean, we can go on, and I'm sure we'll talk more about it.
Yeah, we are.
But the neurotoxin, also a great option that's not adding volume, but also creating more of a lift.
It's a wonderful first step into this whole process,
Yeah.
Yeah, it's awesome. And then moving on, these other things that people have been asking for recently, right? The trapezius tox, right? So that's the Barbie Tox. That's what it's called, the Barbie Tox. Yeah, that's pretty interesting. How long do you think that lasts for? What do you?
It's a good amount. I mean, it's usually a dense amount of neurotoxin in a small, somewhat area, right? The one thing you got to think about is the muscle group. It's a large muscle. It's an active muscle. That's right. So. Depending on, how long you've been getting the neurotoxin, you very likely will see more longevity as you continue with therapy. I still use the same 2 to 4 month timeline for my patients.
See how it goes.
Often when I'm doing that trapezius a neurotoxin injection, it's mainly for, at this point, a lot of physical characteristics, so I'm often injecting the Masseter and the occiput and doing that. So it's more of like the disconnect of a lot of muscle groups, but it's a beautiful thing. Yeah. With the Barbie Tox, they're also seeing, what appears to be an elongated profile.
Yeah, it's really
more symmetry. Usually people are a little more dependent on one side or the other, so you can create better symmetry balance.
Yeah, it's really cool.
I mean, neurotoxin, like I said, it is a cool thing that requires a really cool skill set. I had a patient not too long ago in Northfield, beautiful young woman, young mother, unfortunately suffered a cerebral stroke. Had left-sided facial paralysis. Beautiful lady, but really impacted her confidence due to the fact that she had no control over her mouth. So she drooled. Right. I was able to utilize neurotoxin in a way outside of the box where I created a more symmetrical facial shape for her.
Yeah.
But also injected the salivary gland, which I reduced the activity of the salivary gland, and she was no longer drooling.
That's what's up. That's awesome, dude.
You know what I'm saying?
That's fantastic.
I mean, this is, I don't say that to like gloat and make it really unique, but like this is the power behind this tool. And not only behind the tool, but behind the user, behind the needle.
That's right.
Right.
That's right. And that's where it is. Yep.
I don't like to toot our horns at the Garment Spa, but toot toot. You know what I'm saying? Like this is something that we have perfected and studied and continue to study.
That's right.
We're done seeing patients today, but it's not uncommon for me to go home and try to look up something new or read a study or find out
what's going on.
How we can get better.
So it's such a basic thing, and it's offered by tons and tons of people these days, but there's a humongous difference between, and I've said this so many times, really excellent tox and that like run-of-the-mill good tox. And you really don't know you're getting excellent tox until you get it.
Yeah.
And once you get it, you're going to realize how bad that good tox was.
Yeah. So that brings me to my point. What does it mean to you when the Garden Medical Spa offers $10 per unit?
Yeah, so that's another thing. So this was a tough one because I hate these $10, because the $10 unit thing is
I guess let's unpack that though. Really, maybe people don't even understand what that means.
Yeah.
Unit, right? Price per unit. Like you want to just a brief description for the consumer. Maybe they don't know Like, do I need 5 units? Do I need 20
Okay.
units? You know, and
Yeah.
why does that matter?
So, it's placement. It's also, it is units, of course, but it's also, I would say, placement of those units is more important than the units themselves, and I think there's a misnomer here. I think before botulinum toxin was widely accepted, I think that people were very timid on saying how many units. And
Hmm.
there was this thing that a lot of people, if they've went to kind of these places that are doing like mediocre tox or whatever, they'll come in and they'll say to us, "Oh yeah, I'm used to getting 30 units total." And we're like, "What?" Because I guess that they're stuck on these old mindsets. I don't even know. I don't even know what that is, but that's kind of a little bit off. I would say that the average person, say I'm 42, I think you're 40,
Hmm.
right? For say there's a woman our age group, they're probably going to get anywhere from 50 to 60 units. I'm
Yeah,
probably getting 70 to 80 units because this area here, and
strong.
I'm
Yeah.
half Persian and half Italian. So like, I'm like,
Yeah, you're
oh,
furrowing at me as
right.
we speak,
Yeah, I'm
man.
like this. I'm like, oh man, I got time. So I'm like,
Yeah.
up there. But I mean, when it's placed in the right way, it can settle and it doesn't look like you're getting tox. I'm never frozen. We don't freeze people.
Yeah.
And even at the 60 unit mark, you're not going to freeze. The typical price point, we go by area in a normally, right? So but it usually ends up being like 14 to 15 bucks a unit, I would say,
Yeah,
is like
that's
the
the national
average.
average.
Yeah,
Yeah, no
national
doubt.
average, right? Yeah.
Yeah, for sure. I think, yeah, I know. I'm glad you unpacked that
Hmm.
because I know there's a lot of injectors, a lot of medical spas that struggle to get that word out there. And, the standard FDA approved dose for botulinum toxin, Botox branding was 64 units for the upper one third. That's a standardized dose.
Yeah.
That's not for everybody, but that's just what we start with, right? So, to your point, not everyone gets that, but
Mm-hmm.
that's what came from the studies,
Mm-hmm.
right? That's what's supported by science. Oftentimes I'll get clients, whether they're younger, older, you name it, they'll come in and say, "Oh, I only want a little bit. I'm only looking to prevent wrinkles."
Right. Right.
And if you stop and just kind of unpack what you're saying and you think about that, like if we're thinking about prevention, that means as much or reduce that dynamic activity as much as possible for as long as possible.
Mm-hmm.
And like anything, this is a medication that's dose, the result is dose dependent. So the more of that medication you have at the target, the longer you're going to be able to preserve and prevent
That's right.
those wrinkles.
Right.
So if you're looking to prevent wrinkles, it's sometimes often better to have a healthier amount of neurotoxin in the region so it lasts longer. It's a medication.
That's right.
If someone, and you've treated people for a long time in medicine,
Mm-hmm.
and if someone comes in with an infection and they said, "Oh, I only want 2 milligrams of amoxicillin,"
Yeah. Or they
you
want,
know,
can you fix this in 5 days of
yeah.
trip? And you're like,
And it's
this
just
needs
like, well,
14
if you
days.
don't
Yeah.
use the right amount of medication to
Right.
treat the problem,
Right.
it's not going to fix it.
Exactly. Right.
So
Yeah.
I look at neurotoxin, I look at a lot of what we do just like that, right?
It is. It is.
Yeah.
And I think that we always err on using the least amount for the best result, but it sometimes the number and the unit itself is quite surprising to people. I think people that have been in the game though, they're, I think, used to the hearing that 60 unit thing. I think
Mhm.
the ones that are coming here and saying, if say it's a 40-year-old person and they're saying, I really just want 40 units. I often say to them, um, you know, we've been doing this for a long time. I think that the 40 units is going to get you up something, but I don't think it's going to get you the best result possible. And that's what we're always gunning for. And oftentimes we just, we would say, we're maybe not the right place for you, right? But
Yeah, well, no,
I don't
especially,
know.
I
Like,
mean, and that comes after an
yeah,
extensive evaluation and
of course, yeah,
conversation and
yeah.
education and understanding. And, I think that happens very seldom.
It does
I
happen
mean,
very
most
seldom. Yeah,
people understand and appreciate the time we spend educating and
they
what they
do.
need and why they need
They
it.
do.
But
Yeah.
yeah, glad to get that,
No, it's
out of there.
interesting. Yeah. So, but $10 a unit is a kind of a once in a lifetime thing. I don't think we're ever going to do that again.
Yeah.
I think
Yeah.
it's something cool. I think it's Jeuveau has always been great. It's a really it's the first time the bus has kind of been in our area.
Yeah.
So we were super excited about it. And it was really our way of introducing excellent talks to the masses, I think. And
Yeah.
that was my goal out of this. I thought that what's a price point that's going to help people kind of come over to us and experience what it is to truly have a result that's superior than they're used to.
Hmm.
And I think that I urge you to come on over and experience it. It's
I
gonna be a
couldn't
lot
have
of
said it
fun.
better
Yeah,
myself. I
yeah,
mean, I'm aligned with that. It's going to be cool. It's going to be
yeah,
fun. I know our staff's pumped. I'm pumped.
yeah, man.
It's going to
Yeah,
be a good event.
yeah. We look
But
forward to you
yeah,
guys
so
coming over.
neurotoxin, we're doing it all over. I actually got in my underarms for sweating
Yeah, it's a good
probably
idea.
about 2 months ago now. Game changer, man.
Yeah, dude. That is really cool. I haven't delved into that one yet, but that might be on the horizon.
Summertime, coming around. You're wearing a nice light blue
Oh man,
shirt,
that's so
dress
true.
shirt. I mean, it's easy treatment,
That's a
and
good
it
one.
was beautiful.
Yeah, if you guys want that's actually interesting because the underarms do take a bunch of tox, right? They
Yeah.
take a lot. So if you're ever interested in getting some underarm tox, I would say that the $10 unit June 9th event is probably the best time to take advantage of it because you can, and that lasts a long time. It's like 9 months to a year or
I'm
something,
telling
right?
you,
Yeah,
yeah,
something like that.
it lasts a
Maybe
while.
6 to 9
Yeah.
months. Well, I don't want to over promise, right?
The rest
But,
of your life,
Yeah, yeah,
it's-
yeah. Never need it again. But yeah, it's cool. So I think this is really cool, man. So this is our first one. This is went through the talks. I think the next topic we're gonna figure out. We're gonna see how things like pan out, and
Yeah, well, let's do
we'll go
this
from
real
there.
quick. I'm going to
Yeah,
fire
tell
a
me.
couple questions at you. I want you to kind of fire away
Oh yeah,
answers
cool.
about
I like it.
Tox.
Oh,
All right?
okay, good,
All
good,
right?
good.
Yeah,
Yeah,
it's
yeah.
just fire
Oh,
away
this is
and
fun.
kind of
Yeah,
go back at me.
I like it.
All right, what do you love about Jeuveau?
Oh man, I love that Jeuveau is very consistent. I trust the product, and I think that it reacts and it acts exactly how I expect it to every single time I inject, and I
Yeah.
trust it.
Yeah. What's your favorite area to inject?
Probably jawline and neck is really awesome, and probably around the eyes because it's oftentimes kind of just ignored by lots of people. They're just like they just don't even think about it. But man, it can have such a beautiful effect on a
Mm-hmm.
person. Yeah,
Mm-hmm.
even guys, it opens up your eyes and it's just perfect. Yeah.
Yeah, great point. I was going to
Mhm.
ask that. I mean, you treat a lot of guy patients, male
I
patients.
do. I
Yeah.
do. Well, I would say, I don't know. I would say probably 90% women, 10% men.
Yeah.
I think that men should come in. I mean, it's why not, right? It's like, your lady's looking all good. Might as well get a little something. I think guys think they're going to look more feminine. And in reality, they're just going to look less angry and
Yeah.
just more like they were when they were 32 or 30 years old, right?
Yeah.
Like
Yeah.
you can do it where it's like I tell them, I'm like, listen, I'm going to absolutely let you, make sure you move and you even wrinkle a little tiny bit. If that's what you want. If you want to be a little bit more frozen, I can do that too.
Yeah.
But we're not going to get you all crazy and feminine.
Mm-hmm.
You're just going to look like you, but
Yeah.
just refreshed and happy. That's
right.
actually how I know I need to get tox because usually my wife will look at me and say, "Hey, why are you angry all the time?" And I'm like, "I'm not. It's just my regular face." And it's just because I'm so darn strong over here.
Yeah.
It's so funny. But how about you? What's your favorite place to inject?
Yeah. It's gonna probably be lower 1/3. That includes Masseters.
Yeah, that's
The Master. I mean, I've seen so many transformational results by just injecting the Masseters.
That is pretty awesome,
I mean,
yeah.
but the whole lower 1/3. I mean, there's not a time. If I'm doing this junction, I'm hitting the DAOs. I'm doing the
Yeah.
jawline. I'm hitting the neck, just because all of it works so well in unison.
Yeah.
I beautiful thing.
Isn't it interesting like when people don't take in consideration the lower face, but they like get this beautiful look here, but then they're like, 30 here, but then they're like 45 here.
Yeah.
That's not a good thing.
Not a good thing.
Yeah, you should always treat. That's just a little pro
Yeah.
tip there. Treat the whole face. What do you like about Jeuveau?
I'll tell you, I like it's consistent. I like it's precise. It's precision. I have very
precise,
little
you're right.
concern about, especially due to our dilution ratios, but
Yeah.
very little concern about it going anywhere that I don't want it to go.
It lasts a long time too.
Yeah, it's
It really
good.
does.
I think it's
Yeah.
it's forgiving too.
Mhm.
I think it's
That
it
is
gives me
true.
a lot of wiggle room. If I have and we invite our clients back at 2 weeks for evaluation and potential dose adjustment if necessary.
Sure.
But there's very little dose adjustment I often have to do.
Yeah.
But if I do, it's just minor tweaks just to perfect it, and I
And
love that.
Do you mean like around right here? Because a lot
Yeah.
of people, yeah. So what we've noticed when people come into us, a lot of times they'll say, "Oh, previous person never was able to get this line away,"
Mhm.
and I do like that about Jeuveau, where I'm able to kind of feather
Oh,
my injection points, and then
precise.
it kind of gets a little tiny bit right here, so they can still move,
Mhm.
but not overlap that skin.
Yeah. Yeah.
That is so beautiful.
Precision, man.
Yeah, it's beautiful.
Yeah, it's a beautifully precise product.
Yeah.
That,
I like it.
I mean, very little concern about anything once the clients leave. But yeah, I love that about it.
What's the thing what's the worst thing you've had to fix from another person?
Ooh, in regards to neurotoxin.
Yeah, I know. There's been a bunch of other things, but yeah,
Yeah.
neurotoxin.
A lot of it's probably just the lid ptosis, the heavy eyelids.
Yeah.
I've had some pretty asymmetric smiles that have shown up,
Yeah,
and
I've seen those.
I'm getting married next weekend and I can't smile.
Yeah.
So just a matter, and that's something that we often can correct due to the way the
Yeah.
muscles interact. But a lot of asymmetry in smiles, a couple Spock brows here and there.
Yeah.
The lid ptosis is something that really scares the what out of people, and rightfully so, because it can be alarming and scary. Very sensitive muscle that creates a pretty interesting aesthetic appearance.
So that's such an interesting thing. We've seen that before, and what happens is, what's interesting is, a lot of times it's a provider or someone that's injecting the person, and instead of them paying attention and making sure the needle's pointed upwards, right, into the corrugators and the sclabella area here, they're maybe pointed to the side. It oftentimes happens, if you've ever had injections where someone's come from behind you, that you should leave like pretty much immediately. If you've ever had injections where you're laying down and they're coming from the side and the needle seems to go this way, and then guess where that tox is going to flow? It's going to flow here, and it's going to flow into the eyelid.
Yeah, there's a lot of anatomical variances, and for the most part, and I want to highlight, it's a pretty rare occurrence, right? It's not something that should be happening often and frequently, but it does happen. Little foramen here that is a pathway to a very, very tiny levator muscle that affects the eyelid. Often it's usually just a little neurotoxin that touches it. So if it does occur, the duration's pretty short. There's some things that we can do to help it. And we have the tri-lift now in practice, which actually helps. I've used that a little bit on some of those clients that are heavy.
That's cool.
So there's a lot of ways around it, but that's the scariest one that most people come in freaked out and concerned about, especially first-time tox clients. They seem to be really hyper-focused on that. It's a very rare thing. Often does not occur. It does, and if it does occur, we have a lot of mitigation strategies at the garden that we work with.
It's not going to occur.
I always tell it when I train new providers. There's good and great providers, right? And in aesthetics, 99.8% of the time, everything goes perfect. Perfect meaning no occlusions, no vascular events, no heaviness. Everything's safe. That 0.2% though is what dictates good from great. It's the people that know what to do in that 0.2% situation, the bad that happens or could happen, and I'll tell you right now, very few know what to do.
And
right?
also, I would even say, like, a way not to be that 0.2%. I mean, I know anything's possible, but there are a lot of strategies that you can put into play that you don't do stupid things
100%.
and like have stupid things happen. And it really, I mean, it's experience. It's really understanding anatomy, and it's not over
and limits.
A
lot of people just are afraid to admit their limits.
That's right, and we've seen that, and it's a huge problem. I think in this industry, it's a huge problem. I feel like that's a whole nother topic, like understanding limits and like people having respect for this. This is medicine. In the end,
that's a whole segment.
That's a whole segment.
It's driven by influencers, and I mean, this is the industry, right? I mean, the influencers are the ones driving the awareness, and the awareness is often misled by just misunderstanding of what it is they're doing.
And also, it's just because you've started IVs or you've been at the bedside, and I'm not trying to trash anybody, but it's like I hear this all the time, like, oh, I've started, I'm able to give a vaccine or I'm able to start an IV. That doesn't mean anything. Yeah. That doesn't mean anything. And what matters is who's trained you, and it matters that you have a ton of experience, and that in the beginning that you understand your limits, and that you approach the client with respect and respect of what we're doing every day. That's a tough one to talk about.
Yeah, it's good, but I mean, it's important, and I want to, hopefully, as you guys continue to hear from us through this podcast, get a sense of how serious we take that.
Yeah.
How serious our provider team takes that, our entire team. I mean, management team, well-trained, educated, motivated, eager staff, doing things backed by science, with safety being a top priority.
That's right. Everything matters.
I mean, it's just everything
matters. Everything matters. Yeah.
This industry is too volatile. Our patients are too, this is a cash-based service, right? We're not relying on insurance companies, right? And, both you and I have young kids who play sports teams in the communities, right? The last thing we need is problems.
Yeah. The last thing we need are people saying your dad did that to my mommy.
Yeah.
Yeah, we
no
don't do
doubt.
that.
Yeah.
No. In fact, we just like to. Actually, we ignore you if you because we don't want you. Nobody. Yeah, it's very HIPAA compliant here. You know, we will not say hello to you out there or say we saw you at the office. Anyway, yeah, that's right. Well, Travis,
Yeah.
it was this was a good combo. I
No,
think
it was
this
cool.
is,
I'm excited to see where this
yeah.
goes. You
Mhm.
know,
Me too. It was a good
you know,
kickoff, I think, to our podcast here.
yeah.
Yeah. Good stuff, guys. So, leave some comments. If you guys want us to talk about other different topics, let us know. You know,
Mhm.
we'd be more happy to jump into that.
Yeah, I'd love to have a little more structure behind it, but once
Yeah.
again, it's cool just chatting it
Yeah,
up. You know,
yeah,
it's
yeah.
nice to kind of
I
talk
like
about the
this.
day, and
Yeah.
you know, we'll have other providers on here. We'll hopefully have some patients. You know, some
Yeah.
first parent patient experience. You know, they can
Yeah,
talk a little bit
dude.
about their experience at the garden and some of the treatments they've pursued.
Yeah.
But if you hadn't had a chance to check us out, you know, check us out at the Garden Medical Spa NJ.com. You can see all the services we offer out there, you know, anything from energy-based technologies to injectables to wellness,
That's right.
to esthetician services, skincare, you name it, we have it,
Yeah.
all over South Jersey.
That's right. And if you ever want to come in and just for a generalized consult, we do those too. You might just not know where to start. That's a great one to pick our brain at, right? You know,
Yeah.
so it's just give the office a call and we'll be more than happy to get you in and
Build a
chat it
game
up.
plan for you.
Yeah, baby.
No doubt.
All right, cool, man.
All right.
Till next
Till
time.
next time.
All right, guys. See you later.
Later.